I want to start by telling you a story about how I got involved in global health. As a young teenager, I had the opportunity to go to Mexico for an immersion language course. And as I was going from the airport into Mexico City, I was stunned by what I saw. Mile after mile after mile of barrios, slums, poverty, despair. It left me speechless. The injustice, social injustice, economic injustice, health injustice. It rocked me and shook me to my core. It left me with a sense of moral unease and disquiet that I carry with me every single day, even here today with you today. We have a global health crisis. How tragic is it that a child in Swaziland is 30 times more likely to die before the age of 5 than a child born in Sweden? Billions of people lack access to adequate health care and are in ill health. But I think we shouldn't be in denial about this, because literally we could walk out this exit right here, just a few blocks down the street from where we're sitting right now. We would be at Bayview Hunter Point, and we would see 5-year-old Latino and African-American children who are already pre-diabetic, asthmatic, obese, and depressed. This is in San Francisco, arguably the place where we have some of the greatest healthcare infrastructure in the world. We have a global health crisis. We have to take as our presence that health and wellness are human rights, not privileges. We have an obligation to act, to engage with people and communities to confront this crisis. It's my fundamental belief that every human being deserves good health. But, and as you heard with some of the speakers before me, we have a new reality of global health. It's actually not what you think. In fact, when we look at trends over the last number of decades, when we see the increasing different burdens of non-communicable diseases, so-called chronic illnesses, we're seeing a very disturbing trend. You know, in 2002, there was probably equal balance in terms of the health burden between communicable, non-communicable diseases. But what we're seeing, and as we project into the future, is a rather dramatic increase in the burden of non-communicable diseases, so-called chronic illness. In fact, non-communicable diseases are now the leading cause of mortality in the world today. It's dramatic. In fact, 63% of deaths worldwide are due to non-communicable diseases. 29% of non-communicable diseases in low and middle income countries occur in people below the age of 60. And for me, perhaps the most disturbing element of the global health crisis is that 7.5 million children die each year from preventable diseases. Now let's look at the major burdens of non-communicable diseases. It's not what you think. Let's look at this. It's cardiovascular disease and its sequelae. It's diabetes and its sequelae. And rather strikingly and disturbingly, untreated mental illness make up the major burdens of non-communicable diseases. Now, in looking at the major risk factors of developing one of these, you're going to be rather shocked, but perhaps not surprised if you've been listening this morning. These are the major factors, risk factors, in developing non-communicable diseases. You can see them. What is interesting about this? They're all related to behavior, lifestyle change. Why don't you ponder that for a moment? Because if it's related to behavior and lifestyle change, we can get to global wellness and health in this very interesting path. We have now to reach this profound conclusion that the road to global wellness and health is through changing behavior. 80% of heart diseases, diabetes, and other chronic illnesses can be prevented, managed, or controlled through behavior change. 80%. That's not a pill. That's not a surgical intervention. That's through behavior change. I'd like to share with you some examples of these dramatic changes. My colleague down at Stanford, David Spiegel, has done some dramatic work. He's taken breast cancer patients, metastatic breast cancer patients, and put them into supportive, expressive support groups and compared them to women who didn't get this. Dramatically, the women who got this opportunity for supportive, expressive care extended their lives significantly over the women who didn't. We also know about the Montreal heart disease studies, looking at people following cardiovascular incident and knowing that depressed patients die more quickly than patients who are not depressed. And within the last couple of weeks, we received this really dramatic news from the United Kingdom. They found that women who stopped smoking by the age of 30 could completely reverse the ill effects of smoking within 10 years. And of course, some of the work that I've been doing for the last 10 and 15 years, working with patients who have chronic illness, specifically chronic pain, helping them adjust to their illness, and with other stress management techniques, have allowed them to have much more functional lives and reduce their dependence on narcotics. Changing behavior. Here's the problem. Our infrastructure, training, and intervention models do not account for this reality. We train people, we have academic programs that are geared toward treating more infectious disease, but not chronic illness. Even Paul Farmer, who was here just a few weeks ago, who is one of the paragons of global health, has come to a similar conclusion. And now he is even advocating for community-based engagement on the global health scale. If we are truly committed to 7 billion well, we have no choice but to radically transform how we think about and approach global health intervention, practices, and training. Today, I stand before you here with my colleagues, and we are announcing the birth of global health psychology, a new field for confronting the realities of global health and for addressing our obligation to reach billions of people. Now, global health psychology is the intersection, if you will, among many different areas of study that exist today. Global mental health, health psychology, behavioral medicine. And then when you look at that and bring it all together, we have now today the birth of global health psychology. You know, this stuff really works. Health psychology works. Changing behavior works. Small changes in behavior result in dramatic improvements in health and wellness. And these principles that we're advocating are based on Eastern and Western principles of prevention, balance, and wellness, where people and communities are connected, engaged, and empowered in relation to their bodies and their well-being. Okay, now we have a big, tremendous resource problem. There aren't enough physicians or healthcare providers in the world today to address this, to close this gap. The Western model of the one-to-one care cannot fill this gap. I mean, for crying out loud, even in San Francisco, we don't have enough physicians to treat the need that is out there. In California, with some of the best medical schools in the world, we can't fill the need just here. Can you imagine the rest of the world? We need a new model. Global health psychology is the way to fill this gap and it's a way to engage billions of people. It's a new field and approach to train healthcare facilitators, enhancers, people who can take this knowledge and transform it and bring it to large numbers of people. It's the multiplier effect. Well, I'm going to tell you a little story about the evolution of this idea. And I do a lot of work in the Middle East. So I was asked to actually go to the Gaza Strip. Now, the Gaza Strip is the most densely populated place on the planet. And I was asked to consult because there's a growing mental health issue among Palestinian children. We found in our research that 80% of Palestinian children have some symptoms of post-traumatic stress disorder. Shocking. Went to Gaza, spoke with a local psychiatrist, looked at him in the eye and said, "Oh my God, how many psychiatrists do you have here in Gaza?" He looked at me and he said, "You're looking at him." One psychiatrist for 1.5 million people. Now, I had come from San Francisco. I was shocked. You know, here we have 5 psychiatrists for every 1 person. So I was a little taken aback by the numbers. It became immediately clear to me that my ability to engage and do something about this was going to be limited by the training and the methodologies that existed. So what we did, we developed something called the Community Mental Health Training Program, which was the birth, if you will, or the starting part of this global health psychology. So rather than thinking that we were going to do one-to-one interventions, what we did rather was train local physicians, nurses, social workers, psychologists, and other healthcare providers on the principles of global health and wellness. So rather than the one-on-one approach, each one of these individuals was reaching out into the community, places of worship, schools, clinics, community centers. And I'm proud and really pleased to report that in just less than 10 years, with the training of hundreds of these providers, community mental health workers, we now can reach every single one of those 1.5 million individuals in some capacity. That is radical change. Training global health psychologists to reach out, to connect with people, to engage with communities, and empower communities, and what we call these natural occurring collectives of people, slums, refugee camps, favelas. This is our mission. Now, let's look at some of the principles of global health psychology. Here are some of the principles. Connect, engage, and empower. Connect. Hello, Mr. Smith. How are you? Engage. What can we do together to promote your well-being? Empower. Let's work together. Here are the 20 things that you can do to promote better health for you, your community, and your family. Use the naturally occurring communities that exist. I really like also the idea of using the bottom-up as well as the top-down approach. Empowering local communities, but also transferring the knowledge that we do have. And it's also kind of an East meets West and West meets East. We shouldn't throw out the baby with the bathwater. We need to bring these together. It has to be culturally and linguistically nuanced and informed. One of my favorite stories, when I first was going to the Middle East, and I was asking people if they had any experiences with depression. At the time I went, there wasn't even a word for depression in many of the communities that I went to. So we have to do it in a way that's culturally, linguistically nuanced and informed. We have to understand that global health psychologists are facilitators and enhancers. And of course, as has been spoken about today, the power of mobile tech. My colleagues at Akiva Health are developing these technologies now to use mobile technology as a multiplier. It's rather strange and a little disconcerting to go into a refugee camp, for example, and find that people don't have enough food, water, or medicine, but see that 90% of them have cell phones. We do want to leverage that use of mobile technology. And of course, the last point, which is truly important for me, I've been to some very disturbing places over the course of my work in global health. And I have to tell you, whether it's a refugee camp or a community that's been beset by war, occupation, or natural disaster, the resilience and power of the human spirit towards wellness is truly remarkable, and we have to be able to use that. Global health is a fundamental right that benefits us all. One person with good health benefits the entire community and benefits us all, and this is something that we are truly committed to. This is a slide of our project in Mumbai. It's a slum outside of Mumbai. Slum health is one thing that we're committed to, and we're committed to engaging with these principles in the slums of Mumbai, to the refugee camps throughout the Middle East, to the favelas in Latin America, and right here in San Francisco in Bayview Hunters Point. Will you join us today and my colleagues, and will you march with us, walk with us as we build this movement towards 7 billion well? Thank you very much.